So you have back pain. Now what? We're going to go through the common pharmacologic classes of drugs that are used to treat non-serious causes of back pain. Okay, so let's start with NSAIDs. These are non-steroidal anti-inflammatory drugs. Think of the drugs ibuprofen, Motrin, Aleve, naproxen, Celebrex, celecoxib, diclofenac, Voltaren. I've mentioned drugs of two different names. You know, they have a generic name and then they have a trade name, but they're usually the same drug. You have topical versions, you have oral versions. The oral versions work better for back pain than the topical versions do. Now, if you have kidney disease or you have gastric ulcers, you don't want to take this medication because it can make the disease worse. If you don't have kidney disease or GI disease, it doesn't mean that you can't develop symptoms. If you take a large enough dose of the ibuprofens for a long enough period of time, then that can increase your risk for developing kidney disease. We don't know how much time. It's different for different people. So you try to limit the amount of time that you're on high doses of NSAIDs. Same thing for people who take it and have no problems with their stomach. If you take it, you can develop what we call dyspepsia or an upset stomach for a long period of time. Some people have reported an increase in their blood pressures. This is also a slight blood thinning medication. If you're already on blood thinning medications and you need to take NSAIDs for pain, you want to run that decision by your cardiologist or by your physician to determine whether or not your risk is greater. The next class of drugs that we like to use is acetaminophen. This is my second go-to drug for common causes of back pain. So acetaminophen is also known as Tylenol. And the thing with acetaminophen and Tylenol is that you want to be very careful with liver damage. So if you have liver disease or if you have cirrhosis, you have to be very careful with taking Tylenol. It's not that you can't ever take it, but your restriction is a whole lot lower. And it also depends on the extent and severity of your liver disease. Now, you have to take very high doses to develop liver failure, and liver failure from Tylenol overdose is actually very serious and has a high risk of mortality or death rate. Outside of Tylenol, some people will develop a hypersensitivity. Some people may have a skin rash as well. This concludes part 1 of the back pain medicines video. Tune in to part 2, in which I will discuss additional medicines beyond NSAIDs and acetaminophen. Until next time.